Good morning. Welcome to another episode. I am Pastor Michelle Smalls. I have a very good guest with me. Her name is Minister Lisa Blake, and we're happy to have you here. Introduce yourself.
Pastor. Hi, my name is Minister Lisa Blake. I just previously got married 3 weeks ago to a wonderful man of God.
Amen.
I have two children. My daughter is expecting. She's 33, Lachelle. I have my son, Devontae. He's 28. And I have two beautiful grandchildren. And I am a phlebotomist. Have been a phlebotomist for 25 years. Been in the medical field for 25 years. And I enjoy what I do. I enjoy working with people.
Thank you. Well, I'm going to get right to the questions. Matter of fact, what made you pick this topic?
Long time ago, I always wanted to own my own business. I always wanted to give back, to teach others how to draw blood.
Okay.
And I wanted to be able to train others.
Right.
And God placed a vision inside of me, and I kind of let it lay dormant.
Right.
Because I didn't know what direction, direction to take, what way to go. Because I know that God always uses people, places, and things.
Come on now.
And so at that point, I just had it laying dormant.
Right.
Didn't know what direction to go. So one day, a young lady that I work with introduced me to her Facebook page, to a business that she was doing.
Right.
When I went on her Facebook, I saw that she was a certified phlebotomy instructor. And I said, God, this is what I need.
Right.
This was laying in me for a long time.
Right.
And maybe I can get in touch with her. So lo and behold, me and her had a conversation. She directed me in the right direction. I went on the site. I became a certified phlebotomy instructor, where I can teach.
Right.
From there, God moved me to getting a name for my school. So it's called Red Dot Phlebotomy Training.
Nice name.
Because it is a career. Phlebotomy is a career. A lot of people like to say, oh, it's just the lab. No, without the lab, you're just guessing.
Right.
Because you really need the lab and the blood work to determine the health and the well-being of an individual. That is needed. Yes. So with that being said, that's needed. And so the lab is needed, and phlebotomist is needed. So that right there by itself just really incite me, So I had to embrace my vision, because if you don't embrace your vision, the people not going to embrace it.
Exactly.
So I had to embrace my vision. I had to start digging in there. And then my husband, he really inspired me. When we first started dating, I started telling him what I had inside of me, what I wanted to do. And he kind of pushed me into my destiny. And see, a God-sent man will push you into your destiny.
Yes, they will.
They're not going to hold you back. You need to stay home and don't work, or you need to don't do that. But a God-sent man is going to pursue in your destiny. They're going to push you into where you're trying to go. So that's why I bless God for him, and I love him so much, and I bless God for him. Amen. Because he really pushed me to where I'm at now. Right. Because I wasn't making no moves.
Okay. Well, I'm going to ask you another question. What is the proper way to do blood drawing? What is the proper way, how you're supposed to draw blood from a patient?
So when you enter into the patient room, the first thing you're going to do is verify name and date of birth. Because what you don't want to do is get someone's blood cross up with someone else.
Exactly.
That's a very deadly situation. So you enter in, you identify name, date of birth. Right. You match it against whatever they're wearing if it's in a hospital. Clinic setting, you're going to do the same thing. Right. From that, you get the order. You look and see what your patient needs. You already prepare your things. With me, I already have my stuff prepared before I call my patient back. So if I'm in a clinic setting, I look at the order. I see what they need. I pull my tubes.
All right.
And it is such thing called an order of draw. So you have to draw in the correct order.
Right.
You cannot just pull any tubes. That's why I say phlebotomy is a science. So it's not like you got different color tubes.
Right.
Each one of those tubes stands for different tests.
Okay.
You have your chemistry, you have your hematology.
Okay.
And you have these specialty tests that's so like off the charts.
So it's like positive, negative,
right.
Positive A or positive B, basically like that.
Yeah, and then you have like each one of the tubes have additives in it.
Right.
So when you spin, they don't really use the blood out the tube. The only way they use the blood of the patient is having a CBC,
right,
which is a complete blood count. Okay. That's a lavender top tube. That's whole blood.
Okay.
If they're running any type of phenobarbital, clonazepam, any type of therapeutic monitoring medication, that goes in a plain red.
Right.
You're going to spin that down. So they use the serum and the plasma off the blood.
Okay.
So when we draw the blood, it goes in the tube. We let it clot for about 45 minutes, 30 to 45 minutes. Sit it in the centrifuge. You spin it down.
And it spins.
So it separates the blood from the plasma or the serum. So that's what they use. But you do use whole blood also. You have some that you don't have to spin. It depends on the test and what they're having done.
Okay. Well, wow, that's interesting. I mean, those who watching, this is a very interesting thing. Y'all getting first class now. Y'all getting this first class from Minister Lisa Blake. She is really good, and I'm about to ask you some more questions because I'm excited about this. Well, the next questions I have, matter of fact, how long you been a nurse? I know you said it in the beginning, but actually, how long you been into it?
I've been actually drawing for 25 years now. I started out years ago, probably back in 1980, 81, somewhere up in there. No, probably not, probably middle 80s. So I went to school for medical assistant. That was my main thing. My children was young. I was a single parent. I raised my children by myself. I raised them with the help of God.
Great job.
And I realized the money I was making at the time, I was not going to be able to take care of my children or run a household.
Right.
So I decided to go to school. And I went to school for medical assistant. And phlebotomy was a part of medical assistant.
Because I wouldn't be able to pronounce that, no.
Phlebotomist.
I tried, Lord knows I tried.
So I went to school for a year. I worked and went to school. So I went to school in the morning. Monday through Thursday from 9 to 1. No, 8 to 1. I left school and went to doctor's care and worked from 2 to 10 at night.
Amen.
So I was going to school, but at the same time, I was getting my hands on training too. So I did that for a whole year. When I graduated, and I don't know if too much parents do this now, but this is what I did because I was kind of not present.
Right.
I had someone watching my children while I went to school and worked. So when I came home, they was in bed for school.
All right.
So when they got up, I saw them off to school. So now in the back of their mind, they're probably like, why every time we wake up in the morning she here, and then at night we go to bed, we don't see her until the next morning. So when I graduated, what I did, took both of my children to my graduation. They sat on the very front row.
All right.
When I graduated that day, I wanted them to see this is what your mom was doing when I wasn't present.
Right.
I didn't want them to think I was in the streets, you know, not being present, doing other things. No, I was here trying to make a better life for you two. And I wanted them to see that, what I was doing that whole year when I was absent and not present.
Right.
So my kids came, saw me graduated. I worked at Palmetto Primary for 11 years in the lab.
That place.
I worked at MUSC for 8 years in the lab. I have turned exam rooms into a lab.
Wow. Wow.
That was just turned into a laboratory.
Mm-hmm.
And during the years, I decided I wanted to stick with the lab.
Right.
It was
right.
less stressful to me.
Mm-hmm.
I love medical assistant too, but I love the lab the best.
Yes.
So I stuck with the lab, and that's what I was doing for 25 years.
Okay. Wow. Whew. This is something. Okay. What is the medical term for drawing blood? But I know you
The study of it is phlebotomy.
Yeah,
that's the study
thank
of
you for helping me with that word.
blood.
Thank you for helping me because, matter of fact, I was dreaming about that word last night. I was like, how am I going to pronounce this word? I said, Lord, please let Minister Lisa pronounce this word for me when we get here. Y'all hear that, audience? I needed Minister Lisa Blake to pronounce that phlebotomy. Yes,
Yes, phlebotomy.
Yes,
phlebotomy.
right.
So it's the study of drawing blood. Phlebotomy is the study of drawing blood.
Mm-hmm.
Phlebotomist is the person that's performing the phlebotomy.
Okay.
Yeah.
Okay. Wow. Woo. All right. What are the steps of drawing blood from a patient? I mean, I know you already said that. It seems like I'm kind of recapping again on some of the questions.
So you want to actually know the procedure?
Yes.
Okay. So the patient
For those who
come to the lab to have blood drawing?
Or for those who wants to get inside the type of work that you do, help and probably want to do it privately how you want to, which I think you should.
Yes.
Because that's your calling, your vision, and your vision is going to come forth. But for those who does not know how to use, because I know there are a lot of nurses out there that draw blood, but not having the right type of needle to draw blood. Especially if you have a vein that's like a running vein.
Right.
So there's something that you probably need a tiny.
Well,
needle for that.
They are called butterflies.
Okay.
So, but you have different sizes. You have 23 gauge, you have 24, you have 21 gauges.
Okay.
So the term, when they love to tell patient, oh, your veins roll, your veins this and that.
Rolling vein.
But I take that as I don't think I'm going to be able to get this blood. Because our job as the phlebotomist is to anchor the vein.
Right.
So it don't roll.
Right. So you tap on it.
Right. Well, you tie your tourniquet. You clean off the area in a circular motion. You don't go back in the same area. You go in and you go out because you cross-contaminating it.
Right.
So you let it air dry, or you can just wipe it one time with the 2x2 gauze. You take your butterfly needle.
Okay.
You detach the adapter. It goes into what you call a needle holder.
Okay.
You screw that on there.
Okay.
And then you have your tubes already ready. When they make a fist, and see, I was taught to do blind stick phlebotomy. So it's a difference between blind stick and just like looking for a vein.
So what is it?
So blind stick is when a patient they have veins, but you can't see them.
Right.
You only can feel them.
Okay.
If you train yourself or go through a training that teach you mostly how to blind stick versus what you see, you will always get a vein.
Okay.
But where they freak out at is why the patient gets stuck so many times, because some people, lab techs, go in and they don't see a vein, so they go in and they start moving that needle around. That's a no-no, and that's a danger ground because you have nerves.
Yes.
You have nerves in there. You can actually hit a nerve and cause nerve damage. So that's why I say phlebotomy is a science.
Right.
It's not just something like, oh, it's just drawing blood. No, it's more than that. It's a science. And so you feel for the vein and you go from there.
Okay.
Because 85 to 90% of patients have veins that you cannot see.
Okay.
So if you learn how to blind stick by feeling, when you don't see a vein, you won't freak out because you know the vein is there. and you feel the vein, you just don't see it.
Okay.
So you have to be careful how you go in, because that nerve pain will run all the way up, and that's a painful thing to have.
Yeah. Okay, so so what if someone who's anemic and they wants to go get their vein, get blood drawn, or either get hooked up to IV or something with some medicine into it? How? Okay, how am I gonna put this? Okay, how you supposed to get into the vein? Like far as putting the IV. I mean, for if a person wants to go to a medical clinic or whatever for about some hours or so, and when the person tried to put the needle into your arm and does not know and just sticking you everywhere, I mean, what suggestion would you have someone
for the patient?
That might be kind of scared? Yeah, that might be kind of scared or something like that.
So in a nutshell, you mean like, what would you tell a patient who's fearful of needles that gotta have blood drawn? Like say, like
either get hooked up to, if you're anemic and you have to get hooked up to a machine
for infusion.
Yes, infusion.
Okay,
blood infusion,
so the infusion needles and IVs are totally different from drawing blood.
The iron, I think. Yeah, for the iron.
Yeah, for the iron. So iron infusion.
Yes.
So that's where the RNs and stuff handle that. So that's mostly like dealing with intravenous infusion. So they use the IV intravenous needles for that. Now those are pretty large because the bevel on the end, so they call the hole on the end of the needle the bevel.
Okay.
That's what they're called. So the IVs, when they start an IV, that bevel's kind of big because that fluid have to flow through there.
Right.
And depending on the medication, some medications be kind of thickish, not thick, but it still have to be able to get through that needle into the vein. So the bevel on the end is what goes into your vein. See, a lot of people, when patients, they see needles, and the needle can be this long.
Yes.
But they're thinking, oh my God, you got that long needle. But what they fail to understand, it's not all of this that's going in your vein. It's the bevel that's on the end of the needle that have the hole open it.
Okay.
That's the part that goes in the vein. Now for an IV, they actually insert that and pull out the other little inner plastic. That's different.
That's why I don't like needles today.
But with phlebotomy, you're not leaving a needle in. You going in, you just putting the end of that bevel in there.
Okay.
So it is such thing called vein damage. You can really damage someone's vein if you don't know what you're doing with phlebotomy. You can damage a nerve. So you really have to know what you're doing.
Okay. Well, I understand you brought some materials with you. You brought some card and some flyers you'd like to show everyone.
Yes, I have my flyer here. Is Red Dot Phlebotomy, LLC. I have my contact information on here. My phone, my cell is 843-614-2730. And you can also reach me at lisapalmettoprimary@gmail.com. Or you can simply just contact me with this info here. I'm about to start classes back up starting in May. You can give me a call, reach out to me. I'll have that further information for you on that later on. Also, there's $125. You can pay $125 reservation. Registration fee, thank you. $125 registration fee to hold your spot. The whole class, phlebotomy class, is a 7-week course. It's $850. $150 that's included inside the $850 is for you to sit and take your certification. So after you complete the 7 weeks of phlebotomy class, they can sit and take the exam to become a certified phlebotomist. And you will sit under me. I would administer that to you as well. So you don't have to pay extra for the certification exam. It's included inside the $850 total of the class. Everything is non-refundable, but I do accept payment plans because I know everybody don't have $850 to pull out a hat. So I do accept payment plans, but for further information, you can contact me. 843-614-2730, or red dot phlebotomy at Gmail, or Lisa Palmetto Primary at gmail.com.
Okay. And you got some business cards.
And I also have some business cards here. Now feel free to give you some, Pastor Michelle.
I'd probably like to take a flight to my job.
And I'll give you that. It goes some business cards.
Okay.
And I also...
take one for me.
And you can also have... You want a couple?
Yes. One
You a couple of flyers.
Yeah.
There you go.
Thank you. Thank you very much.
Yes, ma'am.
Well, our time has come and gone. But I just want to thank Daryl, Ray. Hello, Mr. Paul Brown. I see you back there, which he's the CEO in Charlotte, North Carolina. He has a TV station. This is Daryl Goodman and Ray Harvey. And I just want, and my husband, John Smalls, he came and he always come with me. Sometimes I'd be forgotten to introduce him, let people know I am so sorry. Baby, love you. But, yes, but I just want to thank my guest, Minister Lisa Blake. She is a minister also. So guess she got your hand, she got your life in both the world and in heaven. So until we meet again, I just wanted to thank everybody for tuning in to our show. And it will not be her last time coming, trust me. And we're going to get some more information on the phlebotomy. I'm just learning this word, and I'm doing real good at it, thanks to Minister. But until we meet again, y'all have a blessed day. Love you. Bye-bye.